The industrial plants in the riverside Louisiana city of Port Allen have worried Diana LeBlanc since her children were young. In 1978, an explosion at the nearby Placid oil refinery forced her family to evacuate. "We had to leave in the middle of the night with 2 babies," said LeBlanc, now 70. "I always had to be on the alert." LeBlanc worried an industrial accident would endanger her family. But she now thinks the threat was more insidious. LeBlanc, who has asthma, believes the symptoms she experienced while sick with the coronavirus were made worse by decades of breathing in toxic air pollution. "That is the one time in my life I thought, I'm not going to survive this," she said. "I'm going to become a statistic. I was that sick." New research, conducted in part by ProPublica, shows she could well be right. COVID-19 can be made more serious, and, in some cases, more deadly, by a specific type of industrial emission called hazardous air pollutants, or HAPs, according to new peer-reviewed research by ProPublica and researchers at the State University of New York College of Environmental Science and Forestry. The study, published Friday in the journal Environmental Research Letters, found this association in both rural counties in Louisiana and highly populated communities in New York. The analysis examined air pollution and coronavirus deaths in the roughly 300 U.S. counties and found a close correlation between levels of hazardous pollutants and the per capita death rate from COVID-19. The U.S. Environmental Protection Agency defines HAPs as chemicals known or suspected to cause cancer and other serious health problems. Under the Clean Air Act, industrial facilities emitting these pollutants are subject to regulations. Hazardous air pollution may help explain the disproportionate number of COVID-19 deaths in communities like West Baton Rouge Parish, home to Port Allen. With 39 deaths as of September 7, the parish's per capita death rate from COVID-19 ranked it among the top 3% of all U.S. counties with at least 30 deaths. Several of its neighbors in Louisiana's industrial corridor also rank near the top of the list. The coronavirus pandemic, which has claimed over 189,000 lives across the country, including more than 4,900 in Louisiana, offers a rare opportunity to study the public health outcomes of both short and long-term air pollution exposure. Because the virus affects the respiratory system, researchers have rushed to study the potential association between mortality rates and air pollution. Early studies, including one looking at particulate matter, distinct from HAPs, but often found with them, have suggested a link. Last year, the Times-Picayune and the Advocate and ProPublica published the series Polluter's Paradise, which used data from an EPA model to quantify levels of hazardous air pollution along the lower Mississippi River's industrial corridor.